Hi, welcome again. Brian Biesick, I'm a PA practicing in pulmonary medicine outside of Boise, Idaho for the Terry Riley Health Centers. In this video, I really want to talk about one of the most important aspects of COPD care. In fact, it's an aspect that the GOLD guidelines have emphasized for the last few years: exacerbations. Exacerbations are when a patient with COPD has increased symptoms, often more mucus production, increased cough, maybe they have to use their rescue inhaler more. When it comes to exacerbations, we have three categories: mild, moderate, and severe. Mild is when there's an increase in symptoms, but the therapy the patient has is sufficient to get them through. Moderate takes medicine. If you provide the patient with an oral antibiotic or an oral corticosteroid, that's a moderate exacerbation. Severe exacerbations require inpatient therapy to get the patient better. The important take-home point is that exacerbations are not bumps in the road. They're not something that the patient is going to get through and recover fully. In fact, they won't get back to baseline for a moderate or severe exacerbation. Unlike asthma, where patients can have a flare and go back to where they were before, that simply doesn't happen with COPD. Exacerbations are sentinel events for COPD patients. They change their lung function, and that lung function is never going to come back or be like it was prior to the exacerbation. And when it comes to treatment, we often will add medications like oral steroids or oral antibiotics. That's great. I would encourage you to treat exacerbations quickly. There's good data that the quicker you treat, the shorter the duration and the less impact of that exacerbation. When it comes to the prevention of the exacerbation, we want to focus on a few things. Vaccines are very important. Think about RSV and influenza and pneumococcal vaccines. All of these can help prevent a flare of COPD or keep that flare from getting severe. Avoiding high-risk situation, wearing a mask if appropriate. Also, make sure the patient can afford their inhaler and is using it appropriately. We need to be checking inhaler technique at every visit. It's important to make sure that they can actually inhale their medication and deposit that where they need it, deep in the lungs. The GOLD guidelines give us very specific algorithms for treating COPD exacerbations. You can see how there's a stepwise progression. We want to provide bronchodilator, advance to dual bronchodilator, add in inhaled corticosteroids if appropriate, and keep moving them up, adding oral medications as needed. Now, on the GOLD guidelines, there is a caveat. We've been talking about eosinophils at 300 or above, and that's typically the number we use. But GOLD makes the point: if a patient is struggling, if they're continuing to have exacerbations, you can drop that number, 300, to a 100 level and consider adding inhaled corticosteroids for those patients who continue to struggle. You'll also see on this GOLD algorithm that if patients continue to struggle and we've advanced therapy appropriately, there are additional options. These may include a PDE3/4 inhibitor. They may include long-term use of an antibiotic, specifically a macrolide antibiotic like azithromycin. It also includes biologic therapy. For those patients who continue to struggle, especially those with elevated eosinophils, they may benefit from the addition of a biologic therapy. That's the real good news. Biologic therapy not only reduces the number of exacerbations, but the severity, and can help slow the loss of lung function. So, as review, exacerbations, they're not bumps in the road. They change our patients' lives, so we need to try to prevent them, and if they have one, treat it quickly. But for those patients who are continuing to have exacerbations, move up on this flowchart. Get to the point where you're adding therapies that can actually impact those exacerbations, prevent them, reduce their duration, and help patients live better lives. Thank you for joining me on this micro-learning video series on COPD. Be sure to check out the other AAPA micro-learning video series.